What's going on, YouTube? What's going on? This your boy Steve Belcher with Urban Health Outreach Media. Thank you for joining me tonight. Thank you. Tonight is going to be a great topic that we're going to discuss. And that topic is understanding hemodialysis catheters. It's very important if you have a hemodialysis catheter and you, they look different, but I have two hemodialysis catheters that one may have experienced. This is one which is called the IJ, and this this goes on the side of the neck right here, but it goes into your vein, your jugular vein, and it goes down, and so it's like this after the surgery. And I know a lot of people have had this really uncomfortable, but that's one catheter. Then here's another one which goes into the subclavian vein and it goes into the heart. So if you have one of the two, okay, one of the two is very important that you watch this broadcast so you'll know how how these catheters work and understand these catheters, because a lot of people go to what they call access centers and get procedures done on it. So it's very important. If you got one of these, you definitely need to be watching this show so you can understand the catheter you got. Hey, Jad, thanks for tuning in. Please share this, man. Share this. So let's get right into it. I'm going to talk about vascular access for hemodialysis, understanding hemodialysis catheters. And just to give you an idea again, this is one catheter. So can you imagine this inside you? This part is on the inside, so you can't see it. And this tip ends up in your heart, in your chamber. And look how small that hole is. So can you imagine the blood that goes through there, the amount of blood? So these little tips right here at the end of treatment, sometimes they get clogged up with blood because remember, this is a foreign material. So blood tends to clot on foreign material. So at the end of treatment, you may still have some blood byproducts right here, this hole trying to clog up that hole, and then right here as well. That's a small hole. So um, this is just one, and then this is the other. As you can see, it got a hole at the bottom as well, and that's what the blood goes through. There go the hole on the side. So these things, man, there's something to have one inside you and walking around, moving, and you moving your neck, and you have this in or this on the side. Just knowing that you have this in you is uncomfortable. So let me start off. What I want to be talking about tonight is the catheter anatomy, okay? Catheter care guidelines, catheter complications, and then evaluating catheter functioning. And then I'm going to summarize it all up, okay? I know, Jared. That's why people with catheters need to be watching this show. And I may, after this, go live on Facebook and do one because people need to, man, do you know how many people have these and don't know nothing about them, have complications, and if they knew what's going on, it could probably prevent them a lot of heartache and a lot of time and energy. So the catheter anatomy. A hemodialysis catheter is also called a central venous catheter or CVC. This tube is inserted into a large vein, usually in the neck or groin. The visible external portion separates into two smaller tubes with caps and clamps. The internal portion travels under the skin until it enters the large vein and ultimately ends in the top chamber of the heart. So this is how it looks. So that's the catheter, and it's going in under the skin into that large vein. Then this part right here goes into that vein and goes down in. And so thus having this hanging out. You see, this is this right here, the catheter, and it's going under the skin into that vein. That's this tip right here. And then it goes into the chamber. This is sticking out under the skin. This part right here is the part that comes outside the skin. So it's deep. It's deep. So the exit site is the location where the catheter exits the body on the chest wall or thigh. So you're just going to see this part is going to be under the skin. This is the only part that's going to be sticking out right here. The tunnel is the area under the skin between the exit site and the entry point into the vein. These catheters have a cuff, a piece of dacron material to anchor the catheter in place and act as an infection barrier. So it'll be, the cuff is going to be somewhere around here, okay? A new catheter has sutures inserted to maintain its position until the tissue grows onto the dacron. So this is where it's sutured at. You can see the two holes right here. There go one, and there go the other one right here. The cuff is usually close to the exit site and may be felt under the skin surface. So the cuff is going to be somewhere right almost here. Okay, and it's going to like lock it in place, and you got the sutures. Catheter care guidelines. Okay, these are general rules for catheter care. Your catheter dressing should remain clean, dry, and intact. Your dressing should be changed by your dialysis caregiver following unit policies and procedures. The exit site and tunnel areas should be inspected for signs of infection at each dialysis session. Notify your doctor or dialysis caregivers immediately if the area around your catheter becomes red or painful. Very important. Wear a mask over your nose and mouth every time your catheter is open to prevent infection. So what they mean, you have that mask on when they take these caps off. When they take these caps off, you gotta have that mask on because germs can go right in here and get right into your blood system. Be sure caregivers wash their hands and wear a mask and gloves when working with your catheter. Do not use sharp instruments such as scissors near your catheter. So don't let, like when they change in your catheter dressing, do not let them have any scissors or anything to try to take the catheter. If tape is stuck or whatever, don't let them bring no type of sharp objects because they can cut into this or nick this and you can have a hole in it. I've seen patients have pin-sized holes in this line part right here. And as you can see on here, it has the length of the catheter, okay? The length of the catheter. So that's how much we know how much heparin to put in. See that 1.7? And then they'll go to inside. You can see the inside go straight down. That's why we put these caps on to close it off. Follow your doctor's instructions regarding showering, bathing, or swimming. Yeah, you got to be careful when you got one of these in if you're going to shower or swim because the germs from the water, remember, this is going into the heart. So if you get any type of germs or bacteria that gets on this piece and you get under that skin and travel the catheter length, I know many dialysis patients that got catheter infections and they had to get these removed and stay out for 3 days and then get another one put in. Do not allow air to enter your catheter. Okay, this is important. Clamps and caps must remain closed when the catheter is not in use. So when you're not using this, you can't open these caps or unclamp it. This is supposed to, when you leave the dialysis unit, these are supposed to be clamped, okay? And these are supposed to have caps on them when you leave. In some places, they cover it up and put a 4x4 so it won't rub on your skin. And there's a lot of patients that come and we gotta, pull the shirt down and put it up under, and this is sticking out. But when you leave, make sure these caps are on. I've seen patients leave out with these caps not on because the technician got distracted. So make sure these are on and this is clamped. I actually know patients who were addicted to heroin who used this catheter to inject drugs inside. So you can't do that. Do not use your catheter for anything other than dialysis. That's why they got it put in here. I mean, it's right here at the bottom of the page. And you can't use it for anything other than dialysis. Because again, the nature of where it's at and the potential of getting an infection. Frequent hand washing helps prevent infection. Frequent hand washing. So now this is a big thing right here. Catheter complications. This is what a lot of people experience with catheters. Complications that send them to the access center or back to the surgeon to get a catheter exchanged or stripped. I mean, this is a common problem with catheters, or complications with them. Catheters are often plagued by problems and as such are the last choice for permanent vascular access behind the AV fistula and the graft. The recommendation is use a catheter only as a bridge to a fistula or graft whenever possible. Catheter complications range in severity from mild and easily rectified to life-threatening. Okay, let me read that again. Catheter complications range in severity from mild and easily rectified to life-threatening. The most common causes of catheter dysfunction are thrombosis, which is clotting and fibrin sheath, formation of tissue that surrounds the catheter like a sleeve, obstructing free blood flow. And that's what I was saying about this. The fibrin sheath is going to be right connected to here. You see that hole? The fibrin sheath is going to cover that, or this hole right here. And the reason is because of the blood. Now, hear me out. Again, fibrin sheath formation is tissue that surrounds the catheter like a sleeve, obstructing free blood flow. Medication that dissolve clots may help short term or in an emergency situation, but typically the catheter must be replaced. Again, even with this one, same thing. You see that hole? That's where the fibrin sheath forms. These are foreign objects going into your skin, so the blood is going to automatically want to clot to it, okay? Or you could get clotting right here to prevent blood going in. I mean, these things are so temperamental, and a lot of patients don't know this. They don't. This information that I'm telling you, they don't get explained like this. They don't get a chance to see the catheter, how it looks, what it's made of, the construction of it, and the reasons why these things happen, to send them to the access unit center. Look how small that hole is. Can you imagine? And you've seen the blood in dialysis machines, about 2 cups come out of your body at any given time, going through there for 4 hours. And then afterwards, we rinse the blood back and it's just sitting there. You don't think it's going to be blood products in the fibrin sheath? Each time you go to treatment, it's going to build up. And that's what happens. It builds over time. And so we put, as they talked about, medication is called cath flow, clot buster. So we put it in, and that's what I was telling you about the length of this Quentin. Where is it at? Okay, here it go. So on here, if you can see that, all right, you see that 1.4 A, and then it has V, maybe 1.4 cc's. That's how much you draw up. But with the cath flow, you draw up 2 cc's, okay, and put 2 cc's in each port. But here, the length of this catheter, you see, it says 1.4 arterial, and then right across from it, it has the V, 1.4 cc's. And that's how we determine how much heparin we put in there as well. Signs or symptoms. So these are signs and symptoms of thrombosis or the fibrin sheath formation. Difficulty or inability to withdraw, because we're putting syringes on here, okay, to withdraw blood or inject fluid in one or both catheter ports. Caregivers may say there is no flow or that it is slow or sluggish. Okay. Infections can occur in the bloodstream at the exit site or within the tunnel. Bloodstream infections are extremely serious and may be difficult to eradicate. Signs or symptoms: septicemia, aggressive infection in the blood, is characterized by fever, shaking, chills, rapid pulse, and low blood pressure. Hospitalization, catheter removal, and antibiotics are required. Exit site infections usually have visible drainage or pus at the opening or on the dressing with reddening skin and tenderness. Tunnel infections are less frequently seen. The skin over the tunnel tract is reddening and tender. In some exit site and tunnel infection cases, the catheter can be exchanged with a new tunnel and exit site created. But in the more serious cases, the catheter must be removed and a new one inserted on the opposite side. Antibiotics are administered. Central vein stenosis, another complication, is a narrowing in one of the large veins. Okay, I'm sure you heard of that. May be caused by sustained injury to a vein wall from the catheter. Although central vein stenosis can be treated with balloon angioplasty, it is a recurring problem. Central vein stenosis may prevent future access placement options. Signs or symptoms: progressive swelling of the face, neck, and arm on the same side as the catheter. That is very important because I know a lot of people that that's happened to and they didn't know what caused it. Then you may see them with the large arm, okay? If you see that, it's because of central vein stenosis, okay? Another one, catheter dislodgement. Position is lost. A catheter may become dislodged and fall out if body tissue does not grow onto the cuff. Sutures are removed before the tissue ingrowth occurs, or the catheter becomes entangled like your clothes and is accidentally pulled out. I've seen that many times. Patients sleeping with the catheter, waking up in the morning, and the catheter came out, and they bringing it in to dialysis, and it looks just like this. They say my catheter came out. Signs and symptoms: the external portion of the catheter appears longer or the cuff is visible. The catheter may actually fall out. Evaluating catheter function. This is how you evaluate your catheter function. Patients who are well dialyzed and remain infection free generally feel better and live longer. Adequate waste and fluid removal is required with each hemodialysis session. So a well-functioning catheter is required. Your techs and nurses monitor catheter function during dialysis, but with some basic instruction, you can also be involved. See, this is what I'm saying. Your doctor will prescribe a blood flow rate to maximize efficiency of the blood cleaning process. The blood flow rate is the numeric pump speed displayed by the blood pump. The minimum acceptable blood flow rate is 300 milliliters per minute. Your prescribed blood flow may be higher. Know your ordered rate and be sure to check your flows during treatment. If you are not running at the ordered rate, ask why the number is different. I always say that, and here's other information validating what I said. Dialysis caregivers also monitor two other readouts related to catheter function: the arterial pressure, AP, and venous pressure, VP. Arterial pressure measures the catheter's ability to send blood to the artificial kidney, while the venous pressure measures the ability to return blood back into the body. Arterial pressure should never exceed negative 260 because red blood cells may be damaged, releasing potassium into the bloodstream. High potassium levels can cause heartbeat irregularities and death. And so here's a picture of the machine, and this is where they monitor the arterial and venous pressure on here, okay? And then here go the blood flow rate is right. You can see it right here. Right here is the blood flow rate. I mean the pump. That's the pump. And then that's how you know what speed you're running right there. And then here's where you monitor the arterial and venous uh, alarms. So we trend the blood flow rate, AP and VP numbers over time to evaluate changes in how well the catheter is working. So what they're saying is they look at your numbers over time to see if you're still running effectively at that ordered blood flow rate. For example, your ordered blood flow rate is 400. In January, the usual AP and VP were at 180 with the blood flow at 400. In February, the usual AP and VP were 200 with a blood flow of 400. In March, AP climbed to 250. The VP was 220, and the blood flow rate was 380. These changes tells them that the catheter function is declining and that a catheter exchange procedure may be necessary. You may have noticed that the clamps on the catheter and blood lines are color coded, which these right here, what they're talking about. But see how this is red and this is blue? And then on the lines, they're red and blue. One is red and the other is blue. The red line is connected to the red catheter limb for blood flow to the artificial kidney, and the blue line to the blue catheter limb for blood flow back into the body. Occasionally, we may reverse the lines, okay? Occasionally, we may reverse the lines if the pressures are too high or we cannot achieve or maintain the prescribed blood flow rate. So what they're saying is if nothing's coming out of the arterial line, then, and if it's something coming out the venous line, you're going to use the venous line as the arterial and the arterial as the venous line. And that's backwards. And you usually don't get a good dialysis when you run that way. This is another indication that catheter function is declining. Reversing the lines generally decreases the effectiveness of waste removal and dialysis and is not a long-term solution to blood flow problems. A new catheter may be required. So in summary, participate in your dialysis treatment. Follow the catheter care guidelines and be sure that the caregivers do as well. Be alert for any signs or symptoms of complications. Know your numbers and monitor any changes that may indicate your dialysis treatments are becoming less efficient. Finally, take an active role in your health care. It can make all the difference. Guys, this is very, very important, especially if you have a catheter. Again, I encourage you to take care of your catheter, know what's going on, and know everything you can about it to stay infection free. I want to hop on over to Facebook and do a quick broadcast. And I want to call it tonight. I got to hit all warriors and make sure they know about this, what's going on, because knowledge is power. And as they say, my people perish for a lack of knowledge. So until next time, guys, thanks for watching, Jared. I appreciate you coming on and adding flavor and conversation and dialogue to this topic. Until next time, YouTube, have a great evening. This is Steve Belcher signing out, Urban Health Outreach Media. Peace.